There is rehabilitation after repair of the tendon. And the first part is just to allow the tendon to heal. Typically, patients are placed in a sling for about 4 to 6 weeks to protect the repair. But they can take the sling off to shower, to move their elbow, move their hands. But it's important for them to keep the sling on when they sleep at night. What happens during the first 4 to 6 weeks is the bone actually grows in the tendon. Once that is done, for the next 6 to 10 weeks after surgery, the patient goes to therapy to start moving the shoulder and to regain their shoulder motion. From 10 to 12 weeks, we start strengthening the shoulder. And the shoulder is strengthened, and most people are really happy with the shoulder about 4 to 6 months after surgery. So yeah, there's rehabilitation. It just takes time for the tendon to heal and the shoulder recover. But once it's recovered, the success rate's pretty high. About 80% of the time, the tendon heals to bone, and patients are very happy with the results of their function, and they regain their strength between 4 months to a year. Even the strength can increase between 1 to 2 years once the tendon is fully healed. So not all tears are alike. Some tears are small, and we call those small tears. They're medium, large, and massive tears. Now, most rotator cuff tears can be repaired arthroscopically. Some tears, though, the tendon is very poor quality. It's like tissue paper, and the muscle is degenerated. It can't generate a force. And those tears are called irreparable rotator cuff tears. Irreparable rotator cuff tears, though, can be treated. They're either treated by a superior capsule reconstruction or muscle transfers. When the tendon is so bad and there's arthritis in the shoulder, those tears require a special joint replacement called reverse shoulder arthroplasty for repair, and that works really well. To know if a tear is irreparable, you get a clue sometimes on the pre-operative MRI scan. If a patient has a pseudoparalysis or they can't lift their arm up greater than 90 degrees, and the MRI scan shows significant tendon retraction medially and with significant fat replacement, then you get a clue the tendon's irreparable. Now, in order to know for sure, you have to go in and tug on the tendon. And if the tendon is like very poor quality, like paper thin or like tissue paper, then it can't be repaired. So you know, based on the physical examination, you get a better clue with the MRI scan. But in order to know 100%, you actually have to do surgery. Now, those irreparable rotator cuff tears can be treated, and there's special things that we have developed recently to help those people. One of them is a superior capsule reconstruction. And what that is you take a tissue, a processed skin actually, and you tie it down, you suture it in arthroscopically to push the head down, and the remaining tendons that can be repaired, you repair it. And there's some preliminary results that show that that can help people regain strength and decrease pain. The other treatment options for an irreparable rotator cuff tear are muscle transfers. If the patient has a good anterior muscle, subcapularis, you can do a latissimus transfer or a muscle transfer into the rotator cuff, and that can significantly help people get their function back and decrease pain. The third thing, if the patient has pre-existing arthritis, or in special instances, if they're elderly, is a reverse shoulder arthroplasty. Now, reverse shoulder arthroplasty has been on the market since 2004, and it's basically a mechanical rotator cuff, and it's really a joint replacement. And we can do that for people, and that's like the last resort, but it does really wonders. It decreases pain and it improves function. And that's reserved for people that can't have difficulty lifting their arm up. And so what we call pseudoparalysis, or inability to lift their arm up above shoulder level.